Hello viewer, thank you so much for watching Cloud Health Media. My name is Asaph Byamugisha. Cloud Health Media, it is an online program that brings you everything concerning health. And today we are very much glad to have a medical personnel, and he's rich in knowledge concerning cancer disease. Well, Doctor, you're most welcome. Thank you so much for joining us. And Cloud Health Media Program, this is a platform that gives an opportunity to every other person who watches to know a lot of things concerning health. Please, may you introduce yourself to our viewer?
Thank you very much, Mr. Isaac Bernard, for welcoming me, for hosting me on this platform. And I'm delighted to come to this platform to share a bit of the knowledge with our viewers concerning childhood cancer today.
Well, our dear viewer, today we are talking cancer in children. We also want to know, do also children get this disease? Can we stop it? How can we handle a child with this disease? Doctor, please let us know, what is cancer?
Thank you very much, Mr. Isaac. And I will try to explain so that a person listening in and watching understands what cancer is. Cancer is a chronic illness that results from abnormal growth and function of our body cells. Our body is made up of cells. Cells are tiny parts of the body that do various functions in our body. So those cells, every other time, they grow and function, and when they reach their maturity, those cells die. So normally we have body cells, and these body cells divide every other time. They divide, they grow, then they function, they perform their specific functions, and then after that those cells mature and die. So in a scenario of cancer, because of some factors that I will explain, some of them genetic and environmental, those cells grow abnormally, because ideally there is a process of stopping, there is a process of controlling the way cells grow. There is also a process, the body has a normal mechanism of controlling growth of the cells, controlling the function of the cells, and the body actually is the one that manages and controls cell death. So cancer cells are abnormal in a way that their growth is uncontrolled, their function is also abnormal and uncontrolled, but also they cannot die. When those cells reach a time of full maturity, or the time when they are supposed to die, those cells do not die. So when they don't die, they keep piling. They keep piling, and that's why, so when they don't die, they keep piling, and in the end you find that they become cancerous cells, or you find you get a mass. I'm going to use an example, for example, a breast. If those cells that I'm talking about are in your breast, it means they will keep growing and growing and growing. So in the end, you will have a mass in your breast. Some of those cells actually spread from the body part where they started, and they go to other body parts. They can spread from, for example, your breast, and they go to the lungs. They can spread and they go to the brain, and actually that is what we say advanced stages of cancer. So that is cancer, basically abnormal growth and function of cells. The cancer cells disobey the natural mechanism of controlling growth and death of body cells.
Well, Doctor, thank you very much. Today we are talking about cancer in children. But before we basically talk about cancer in children, what is the statistics now of cancer apparently?
In world over, about 400,000 patients of cancer are children below the age of 19. and a rough estimate is about 10% of cancer patients are below the age of 19. And still globally, cancers are now overtaking infections as the leading causes. Globally, cancers are now taking over infections as a leading cause of death in children. For example, currently, about 3,000 children in Uganda are diagnosed with HIV. But it is estimated that 7,000 children below the age of 19 are estimated to be diagnosed with cancer.
Is there any relationship
every year
between cancer and HIV?
Now I'm just comparing the numbers of cancer and the numbers of a common infection like HIV. So currently we have cancer trying to overtake HIV and common infections that used to disturb children. When we go to the Uganda Cancer Institute, every day, when we go to the Uganda Cancer Institute, every year they register about 2,850 children with cancer. And I will tell you that this is an ever-growing challenge. Children with cancers, the number of children with cancer is increasing day by day, according to the crude estimates from the Uganda Cancer Institute.
Now, Doctor, we used to know that cancer is among the diseases for all the people. How come we also have that problem in young children?
Thank you very much. Among the causes of cancer, there is a broad categorization of genetic causes and then environmental exposures or lifestyle exposures. So in children, common causes of cancer are due to genetics. Genetics, I mean the genes that these children inherit from their parents sometimes are abnormal or have tendencies of being abnormal after being exposed to other environmental factors. So there are some of these causes of cancers that are genetic and therefore can affect children.
Well, we used to know that cancer is brought about by maybe the environment, as you said, what we eat, and basically the environment and what we eat. How about that?
In children, there are some environmental factors that are risk factors for developing cancer in children. I'll give an example of infections. We know there are also children that are born with HIV infection, and the patients of HIV are more at risk of getting cancer. So children who have HIV are at risk of getting some type of cancers, like skin cancer, and infection with other organisms, for example, malaria and Epstein-Barr virus. Those two infections predispose children to developing a certain type of cancer that we call Burkitt's lymphoma. So some environmental risk factors also explain why children get some of these cancers, but largely it is because of genetic factors that children are born with damaged cells, or these cells they acquire, or children acquire damage to the cells that transform these cells to becoming abnormal and uncontrolled.
Well, Doctor, we have a number of types of cancers. I don't know if you now are they prone to all the types? Skin cancer, breast cancer. Are they prone to every cancer?
Thank you, Mr. Isaac. Just like I explained, cancers are of different types, and virtually every cell in the body can get cancer. So there are some cancers that, for example, are more common in women. There are cancers that are more common in men, but there are also cancers that are more prevalent in children. Commonest common cancers in children include leukemia. Leukemia is a blood cancer, cancer of the blood and the bone marrow.
Okay.
That is one of the common cancers in children. Another very common cancer in children is cancers in the brain and the spinal cord. Those cancers are also very common. Then also have cancers that affect the kidney. They are common in children. Then there is a particular cancer that was first identified in Uganda, called Burkitt's lymphoma. This cancer affects children more than adults, and it usually affects bones of the face and sometimes, rarely, can also affect lymph nodes in the abdomen. So some of the cancers are specific to children, but they indeed can also happen in adults.
Well, dear viewer, you are still watching Cloud Health Media program, and with me is Dr. Asaph, and we are talking about cancer in children. And you can also watch and help your fellow to watch also and get information concerning cancer in children. We are looking at how we can stop this disease in our young children. Doctor, now, do we have signs? Anyway, can you identify cancer in children before it gets worse? And do we have signs and symptoms that can tell that really this one is going to have this cancer problem?
Yes, we have signs and symptoms that are not very, very specific. What I mean is, some of those signs actually are also signs of other illnesses, as I will explain. So it is very important.
Like now, when you see, I don't know, children, you're talking of which age, from which age to what age. Maybe if you see a child crying, that may be this is a sign of cancer.
No, not really. There are signs, though not very specific, but can alert health workers to know that there is cancer. One of the common signs of cancer in children is unexplained fevers and illnesses that don't go away. A child gets sick, they test malaria, they treat all sorts of illnesses, and the child doesn't improve. The fever still persists. So you now need to think about cancer. So that is one of the signs. Another common sign that can indicate there is probably cancer in such a child is unexplained paleness. Paleness, I mean the mucous membranes. If you look at the hands and the tongue, you find the child is more pale, which is a sign of low blood, deficiency in blood, and we term that as anemia. So paleness, unexplained paleness, sometimes can signify cancers. Like I told you, we have leukemias, common in children. So if you see a child having frequent paleness, anemias that are sometimes treated and they come back, so you need to think about cancer. Sometimes children present with lumps, masses, swellings. Some of the swellings are actually common around the neck, in the armpit, especially the upper part of the body. Here in our local dialect, some old women call it enteyaban. Sometimes actually, some of them end up therapeutically treat them or attempt to treat them by burning them, which is really traditional. So some children have swellings, masses that really needed to be questioned and examined to find if they are cancer. There are other signs, of course. Sometimes you find a child is complaining of bone pains. Other children are limping because maybe they have cancers in their bones. And sometimes you find children failing to grow. There is the term we call failure to thrive. A child that is supposed to grow does not grow. And they don't actually achieve their developmental milestones. We expect a child of 6 months to be, for example, crawling.
6 months.
We expect a child of 1 year to be standing and trying to walk. But you find a child, if a child has cancer, they might delay to achieve such an important milestone. You find a child just begins standing when they are 2 years, 2.5 years, and that should signify the parent that there is perhaps a problem.
For how long does these things happen so that you can really know that something is happening, something wrong is happening?
Unlike adults, there's a very tricky phenomenon with the cancers in children. They progress so fast. They progress so fast. So it is very, very paramount that there is a prompt or early and accurate diagnosis of some of these conditions. Because if we delay diagnosing properly these conditions, children will end up getting advanced stages of cancer that are very hard to manage, or children progress faster and they can die soon enough.
Well, doctor, there is a usual talk that maybe if cancer is identified so very much early, it can be treated. Now, can we heal cancer in children?
Thank you very much, Mr. Isaac, once again, and our viewers. I would basically want I would want us to pick this piece of hope. I would want our viewers to listen to this piece of hope. Unlike cancers in adults, the cure rates in children is actually bigger. We have higher cure rates in children. In fact, up to about 80% of children treated with childhood cancers, they improve and they get well and they are cured completely. The challenge, of course, is with the sometimes low and middle income countries. Facilities of diagnosis and treatment usually are not up to standard. So our cure rates in Uganda are not that much to about 80%. But information from the Uganda Cancer Institute shows that 55% of children treated for various cancers at the Uganda Cancer Institute actually get cured and heal completely. So you see, this is hope, and I would want really, in fact, listeners.
You reminded me something. Do every facility has that service, diagnosing cancer in children?
Thank you. Diagnosis of cancer in children takes a very high index of suspicion. In other words, the health worker has to critically look at the child and probe for some of these signs. But a very good and well-trained doctor is supposed to elicit, is supposed to identify some of these signs of cancer in children, and conduct some baseline investigations. There are some baseline investigations, like, for example, testing the level of blood to know if a child has anemia, like, for example, doing an ultrasound scan to know if there are masses or if there are swellings in the abdomen. So basically in peripheral health facilities, we can basically tease out some of these signs. But the Uganda Cancer Institute has decentralized the process of diagnosing and management of cancers in children. It now works with about 4 regional hospitals. In our side here, there is a cancer unit at Mbara Regional Referral Hospital. Then other sites include Gulu, Mbare, and Arua. So children within such catchment areas can really be referred to some of these nearer sites, and then they are probed and investigated to see if they have cancer, because cancer is about, you have to do some of these tests to confirm that a child has cancer.
How many times should someone really go for testing before he or she confirms that this is cancer?
Some cancers, of course, are tricky to confirm. But like I said, if a qualified health worker suspects some of these signs, these children should be further evaluated and investigated to see whether they can be having cancer. And if where diagnostic facilities are not adequate, then they should be referred to the regional cancer centers where they can be properly investigated to confirm whether it is cancer or not.
Do you have a stage where you find that this cancer can, in a child, cannot be treated? Do you have stages?
In advanced stages of cancer, like I said, cancer can begin in one part of the body, and if there is delay in intervention, in diagnosis and treatment, the cancer cells can spread from that original part and then spread through blood into other body parts. So sometimes you find some cancers have already spread to dangerous parts of the body, for example, like to the lungs or to the brain, and you find that treatment becomes very difficult, and in the end some of these children die. And like I said, the cure rates are at 55%. So the rest of the children with cancer die, about 45% of them.
You're a medical expert. I don't know if you recommend some traditional herbs that people can use for either first aid or cure of cancer in children, because this is common around.
Thank you very much. It is common that traditionally when someone is not well, they will begin by maybe asking a neighbor, and then a neighbor or a friend recommend a certain unconventional treatment. There are some unconventional treatments that I would discourage people from taking. There is no cure, there is no herbal cure of cancer. There is no herbal cure of cancer. I would want people clearly to get this. And there is not even any herbal preparation that prevents you from getting cancer. So cancer, for you to optimize the outcomes of treatment in cancer, you need to get evidence-based cancer treatment, authentic cancer treatment. That is when we are sure that the cure rates really can improve.
Do you recommend some foods for a cancer patient? We are talking about children. Do you recommend environment that someone should live in so as to stop that problem? Some of the causes of cancer are associated with our lifestyle or the environmental exposures. So this is a very broad category, and I will tell people exactly what they need to do to prevent some of the cancers. And this applies more especially in old people, not children, much as it also helps in children. One of it is good nutrition. Good nutrition, we mean a balanced diet that has enough of roughages, enough of fruits and vegetables. These fruits and vegetables have antioxidants. Antioxidants are chemicals or are elements of these fruits that sieve out the toxins that are in our body so these antioxidants sieve out these chemicals and free radicals that would harm our cells. So it is very important to always eat fruits and vegetables. Number two, we also have to get vaccinated. There are some cancers that can be vaccinated. So the Uganda National Expanded Program for Immunization protects our children against some of the cancers. For example, cervical cancer, you know our girls get the human papilloma virus vaccine. You know our girls are given the HPV vaccine to prevent them from getting that virus that causes cancer of the cervix. And then the routine immunization also protects our children against cancer of the liver. They get that vaccine for hepatitis. So that is also part of a lifestyle. So I would want people to embrace that. And I would also want people to prevent these illnesses. Most of the reason why Africa and these other developing continents
most of the reason why we have a high burden of cancer is because of having a high burden of infections. So a very good lifestyle that prevents infections like HIV is very, very protective against some of the cancers.
Well, Doctor, we are coming to the end, but some people say even people with HIV/AIDS, it can result into cancer. How true is that? And can it also apply to children?
Yes. Infection with HIV predisposes someone to some cancers. For example, cancer of the skin. There's cancer we call Kaposis sarcoma. It affects the skin and is more common in patients who are HIV, because when you're HIV positive, you have a low immunity, and even the virus itself can also infect the cells and also damage the gene and also damage the DNA, thereby resulting in cells getting abnormal growth and behaving abnormally. So HIV is a risk factor for cancers like skin cancer and some lymphomas that affect the brain.
Well, what about this perception that even the body cuts, the wounds, can also result into cancer? Can it also happen?
It is not everything, of course, that will result into cancer. Some of these simple wounds or minor injuries really don't come to be cancers. So they can't transform into cancer. They don't.
Well, remember to watch as you follow our online health program on Cloud Health Media on a number of social media platforms. We're coming to the end. Doctor, may you please, with your last word?
Thank you very much, the viewer. And the take-home message concerning childhood cancer is that, yes, children can also get cancer. And in fact, cancers in children progress faster than cancers in adults. Finally, the good news is the cure rates of management of cancer in children is better than in adults. But for us to optimize cure rates in children, we need to have early diagnosis of these cancers in children, and access to authentic treatment, and adherence to this evidence-based treatment, not the herbs. Thank you.
Thank you very much, Dr. Asaph. Thank you so much, our dear viewer. And we very strongly believe that you are going to join hands and fight this problem of cancer in our children. And please remember that regular medical checkups are very much important for our lives. Remember to take your child for medical checkup daily so that you can identify this problem so very much early so that you can fight it and end it. My name is Asaph Byamugisha. Watch again Cloud Health Media program. Have a very blessed day.